Hi, Doc Corkins again. Continue my talk on the injuries that occur during whiplash, the injuries that specifically occur to the neck. Now, I've talked about a retrolisthesis and I've talked about an anteriorlisthesis, and you can see those in the previous videos. But the most serious one that occurs in the C2 to C7 region is one where there's a combination of both an anterior, that is, if I flex the head down, the vertebrae moves forward, and then when I flex the neck back into extension, then the vertebrae slides into the normal position. It keeps on going and slides to the past or into the back. So as you go forward, if we have two vertebrae, here's your nerve. If you go forward, it slips forward, and if you go back, it slips backward. Now, in this particular model, it's too rigid to show that, but you have to look at the alignment here, and you have to look at the alignment in the posterior longitudinal ligament, that one that follows the spinal cord down. That is a serious injury that occurs during whiplash, and you'll see this in the x-rays.
In case 1, we're going to see a retro and an anterolisthesis. Here is the anterolisthesis at 2.7 and 3.3 millimeters forward slippage of one vertebrae on the other. That's at 4.5 and 5.6, and then when she goes back into extension, they slip backwards at 2.1 and 3.3 millimeters respectively. So as they go forward, it slips forward, one vertebrae on another, and as she looks up, it goes backwards. One vertebrae slips backwards on another. This is a combination of two injuries, an anteriorlisthesis and a retrolisthesis. Here's case 2, again with forward flexion extension. You can see that there are two levels of anteriorlisthesis sliding 1.4 and 3.0 millimeters forward, and when she looks backwards, looks up, the vertebrae slide backwards. I'm only showing one, there's really two here, but one shows up as 2 millimeters retrolisthesis. They're at 4.5. These people suffer from chronic neck pain and spasm, headaches, shoulder pain, jaw pain, sleep disturbances, depression, and this is the beginning of the degenerative process.
We've been looking at whiplash injuries involving translations of one vertebrae on another. The first one was at C1 and C2 at the top of the neck, where you see lateral variations when you go side to side. From C2 to C7, we looked at translations that occur when we look forward and maybe look backward. We've actually measured these translations in millimeters. What is the significance of that? All right, so we measured a movement. For you attorneys out there, I want you to know that these translations are very significant, and they are documented in the AMA guides, the American Medical Association Guides for Permanent Impairment, either the 5th or the 6th edition. Here's the 5th edition, and if you guys turn to find a copy of this book and turn to page 392, you'll find that translations of 3.5 millimeters or more qualify for a category 4 whole body impairment, which has a range of 25 to 28%. That's very significant, and that particular translation compares to, or is comparable to, in the same category, a compression fracture of at least 50% with no neurological signs, a change and the alteration of the motion segmental integrity, that it's involving either a unilateral or bilateral radiculopathy. This is the kind of category these translations fall into. So for those who sit back and think that this motion that we, or this objective evidence that we're generating with video fluoroscopy is nothing but soft tissue damage and it doesn't matter, guess what? The insurance companies have pulled the wool over your eyes. There is significant damage here, and you need to defend your client against that.
So if you've been involved in an accident, get yourself checked out by calling the Advanced Spine Center at 561-433-4184.